causes the pain behind your knee and how to tell. We'll give you some of the common reasons, and again, so you'll be going to doctor's appointment informed.
Right.
So one of the ones that I hear about a lot is it actually you feel a bump behind the knee
Mm.
or fluid behind the knee, and that's a cyst. A cyst is usually the result of a problem that you have inside the knee joint. Conditions cause inflammation and increased fluid, and that fluid seeps into a bursa behind the knee. Plain old arthritis can cause pain behind your knee. Arthritis is generally worse with weight bearing. You know, like when you put weight on the leg, it's going to get worse. Generally feels better once you're off of it.
Right.
It's kind of stiff in the mornings quite often.
Yep.
Or stiff with no movement.
Sure.
A cartilage tear. You might actually tear the cartilage in your knee,
Yep.
the meniscus. It might be due to trauma, or it might be due to just simple wear and tear as you
Right.
get older. Now, with a cartilage tear, you could have swelling, pain, decreased motion because the cartilage could kind of get folded up or block the movement a little bit.
Right.
You could get locking of your knee, like locks up. You hear a creaking or popping of the knee. All these things are a
As we
sign.
get older, it's not
All
uncommon.
you do is you squat with the knees turned out,
Yep.
out to the sides. And you can hold on to something while you're doing this. And if you can't get down at all because of pain, that's a sign right there. You might have torn cartilage.
Sure.
But if you can get down, you try to walk like this.
And if you don't feel steady, don't do it. Obviously, it's not worth
Right.
falling.
Yeah, safety first. If you feel clicking or increased pain, you may have some cartilage damage.
Sure.
A ligament tear, that's generally caused by trauma, and that's not something that just develops.
Right.
So, that'd be more of an athletic accident or athletic injury.
Yep.
With ligament tears, the pain tends to be sudden and severe. So it's usually, you might even hear a pop or a snap.
Yeah.
So it's usually pretty easy to diagnose. You could have a simple muscle strain or
Right.
tear or tendon tear behind the knee.
Might be a hamstring issue, which is pretty common. That's those low hamstrings are probably not as common as the mid
Right,
or
or
the upper. But
right,
it's
and
still-
also your calf muscle
sure,
goes up and across your knee.
Yep.
A lot of people don't know that. So
gastroc.
yeah, you may find point tenderness in the calf or the hamstring muscle. It could be a blood clot, which you can feel in the calf sometimes and behind the knee.
Right.
Less common.